Good morning, my name is Dr. Jeremy McAnulty from New South Wales Health, and I'm here with a COVID update for New South Wales for Tuesday the 23rd of November 2021. There were 173 cases of COVID reported in the 24 hours to 8 o'clock last night. In the same period, there were more than 52,000 tests reported in New South Wales. In terms of vaccination across the state, now 94.4% of people have received one dose of vaccine and 91.9% have been fully vaccinated. For children 12 to 15 years of age, 81% have had their first dose and 75.4% are fully vaccinated. In terms of hospitalisations, there are currently 196 people diagnosed with COVID in New South Wales hospitals, of whom 34 are in intensive care and 13 are being ventilated. Of those in intensive care, 25 have not been vaccinated, 3 have received one dose of vaccine and 6 have received 2 doses of vaccine. Sadly, we're reporting the deaths of 2 people today. A woman in her 80s died at Royal Prince Alfred Hospital. She was a resident of the Presbyterian Aged Care Nursing Home at Ashfield in Sydney's Inner West, where she acquired her infection. This is a second death linked to the outbreak at the facility. Also, a man in his 80s from southwestern Sydney died at Liverpool Hospital. We'd like to express our sincere condolences to the family and loved ones of these 2 people who have sadly died. Today, we're reminding again people to follow the New South Wales health guidelines if you've returned from overseas recently. These guidelines include requirements relating to testing and restrictions to visiting certain high-risk premises. You must have a COVID PCR test within 24 hours of arriving and also around day 7. You're not required to isolate while you wait for these results unless you have symptoms. And if symptoms present at any time, please get a PCR test and isolate until you get a negative result. New South Wales Health has been contacting recent arrivals to remind them of these requirements. And we'd like to encourage people who are planning to host people who've recently come from overseas to make sure that they are fully vaccinated before the guests arrive. And please remind your guests from overseas of the need to get tested and to restrict their movements to high risk locations. Again, if you have any symptoms at all that might be COVID, please have a PCR test at one of our many clinics across the state. The rapid antigen test, or RAT test, isn't suitable for testing people with symptoms. So please have a PCR test if you do have symptoms at one of our clinics. And new treatments for COVID are becoming available in Australia, especially for people with underlying health conditions that mean that they're more likely to have poor outcomes if infected. And most treatments work best if given early, so it's important to get tested for COVID, again with a PCR test if you have symptoms, to get tested early. If you have a self-tested rapid antigen test that is positive, it's critical to get that formally confirmed at one of the testing clinics with a PCR test. This will ensure that New South Wales Health can connect with you while you're in isolation and provide the care to keep you safe. If you have COVID symptoms and your symptoms worsen, please contact your doctor right away before you deteriorate. Again, thanks very much to everyone for coming forward to getting tested if you have even the mildest of symptoms, and for getting vaccinated. By getting vaccinated, we're protecting ourselves and our communities and families. So thanks again.